The short supply of COVID tests, especially at-home rapid tests, is a story we've heard nationally. It's prompting long lines with long wait times across the country, from Wisconsin, where people are showing up before sites even open, to North Carolina, where they have appointments, but still a really long wait. Even Miami, Florida, where some have said the wait to get tested could be hours long. They opened up more testing sites today so people could get in line. With holiday gatherings still expected this week, celebrations for New Year's, we wondered, are people having trouble finding tests in Idaho? If so, where should they turn? Our Katya Stepovic has more on that.
Rapid tests are backordered, probably about 4 to 6 weeks to get another shipment of rapids.
This is Stephanie Hudon, clinical program director at BSU, who says before Christmas break, the clinic was seeing only 1 to 2 positive cases per 90 samples. Now it's pretty typical to see 20.
We've had a really big increase in testing demand over the holiday season. I think we've had a lot more people with symptoms, and with those rapids not being available on the shelves, we're having a lot more people coming in person to test.
But if you're looking for same-day results, it's best to pack your patience because rapid tests are few and far between, even at BSU's clinic, who now only uses them for emergencies, which could mean
as rapids become less available, the turnaround times at all the labs in the valley could potentially be a lot longer.
State epidemiologist Dr. Christine Hahn says the lack of rapid COVID tests isn't isolated to this one single clinic.
For people looking for the kind of rapid at-home test, the Binax Now and some of those other ones that we've been getting from pharmacy shelves, those are in short supply in Idaho, just like they are elsewhere.
But over at SaintAlphonsus, while the demand for testing is increasing, resources are not.
Currently, though, we certainly have capacity to test those individuals who would like to be tested.
But there's a hook.
We are just testing symptomatic people at our centers.
That goes for rapid tests and PCR tests. And while some experts predict the demand for testing will go down after the holidays, others worry we are on the upslope of yet another COVID surge.
Myself and colleagues are just kind of waiting for a bit of a storm to hit us. As we look at what's happening in New York as an example, we know, unfortunately, that it will likely be here. And whether that's next week or 2 or 3 weeks from now, as you said earlier, we tend to be a little bit behind national trends. So sadly, I think that this is what we're looking forward to.
Some unfortunate news there, but Dr. Ashby says the good news is that early data does show the Omicron variant tends to result in a little bit of less severity than the Delta, especially in those who are fully vaccinated. So even more of a reason to get vaccinated. And for people looking for a rapid test, they can still continue to try CVS, Walgreens, or Albertsons, depending on when they will get more shipments in. Morgan?
Katya, another option, I know you talked about this, 211, right?
Yes, another great option that I don't think a lot of people are even aware about is calling that 211 number. Just call 211. You can call Department of Health and Welfare and they can ship a test out to you to your house. They just need your address. And you don't have to be symptomatic, but that's not a rapid test, so it is going to take a couple days there.
Okay. All right, Katya, thank you.